Hi everyone, my name is Ami Bakhtian and my research is on enhancing post-stroke gait rehabilitation through brain-computer interface functional electrical stimulation, BCI-FES therapy. My mentors were Sharavan Tepero and Dr. Ann Du. The economic burden of a stroke in US alone is $56.5 billion per year, and about 20 to 30% of survivors suffer from foot drop. And unfortunately, the only available treatment is the traditional physical therapy, PT, which does not fully exploit the neuroplasticity of the brain. So there is a need for a new therapy, and one promising one is BCI-FES therapy. And how it works is that it uses EEG, which is non-invasive, and it detects the brain signals, and specifically from motor cortex and one area, and it sends the signals to a BCI computer, which uses a probabilistic model, and it has some predefined thresholds, and it distinguishes from idle or dorsiflex move state. Once it determines that the patient wants to move his feet, it activates the FES system, which stimulates the alpha motor neurons that are responsible for initiating the dorsiflexion. And this therapy is used in conjunction with PT. Now you might ask, why is it innovative and why do we even use the BCI device? And the reason for that is that although the brain damage from a stroke may be permanent, the brain has the ability to undergo neuroplasticity and basically assign the function of the damaged brain to the undamaged part of the brains. And based on the Hebbian principle, neurons that fire together wire together, and that is exactly what the BCIF is supposed to do. It co-activates M1 area neurons and alpha motor neurons, and by doing so, it accelerates the connections and neuroplasticity. Furthermore, the sensory feedback, what is seen and felt by the patient when he moves his foot, is beneficial for the rehabilitation since it enhances the brain's capacity to retain and strengthen the neural pathways important for the voluntary muscle control. Our results are forthcoming since this is a 5 years study and we had 66 patients. Our hypothesis is that patients who receive BCI-FES therapy in conjunction with physical therapy will perform significantly better in key measurements such as gait velocity, endurance, and motor function compared to patients who only received physical therapy. And once we finish our data entry, we can also investigate the relationship between BCI performance and gait velocity outcomes, as well as identifying the stroke characteristics that predict BCI control proficiency. Thank you.